The doctor is in.
Hi guys, it's Dr. Sal from DrSecrets.com. Thank you so much for joining in. Today we're going to take a look at toenail fungus. Now, while I'm talking primarily about toenail fungus, all the treatments and all the information presented here are equally applicable to fingernail fungus. It's just that the former, toenail fungus, is much more common than fingernail fungus. However, I have seen fingernail fungus before, especially in ladies who like to wear those stick-on fake nails. Sometimes they leave them on for far too long, and when they remove them, they find to their shock and horror that there's a bunch of fungus underneath their nails. I'm assuming that toenail fungus is far more common just because with your toes, they're in contact with the ground surface, so much more liable to pick it up from the environment. So anyway, moving on. If we look at the anatomy board here, you will see a very typical picture of nasty nail fungus. Now, the characteristic features that you should immediately jump out at you like a sore thumb or a sore big toe would be the discoloration. It's not white anymore. It's lost its pearly color, and now it's kind of a yellow jaundice look. The other thing to notice is rather than nice smooth integument, the nail is brittle, it's shattered in pieces. It looks rather unhealthy. And this separation or lifting off of the nail from its nail bed, our term for that is onycholysis. Basically just means separation of the nail from its anchors. So how do we treat toenail fungus? Oh, this is another example of some nail fungus. Very often the big toe is usually the one most affected, but as you can see in this picture here, some of the other toes are also slightly affected. So how do we treat it? There's several different methods. The first is to use a systemic therapy. So in other words, what we do is we give you an antifungal by mouth, which is absorbed through your bloodstream and then passes through the bloodstream and makes its way all over your body, but some of it obviously will reach your toenails and kill the fungus from what we call the nail bed here. So one example of that would be something called Lamisil or terbinafine, but there's a bunch of other ones as well. Now there's a couple downsides to that treatment. One is that nails grow very slowly. Like on average, it would take 1 year for the nail to grow from its origin here to the tip here. So fungi are also very slow growing. So part of the problem is you need to apply the pressure against the fungus for long enough that you eradicate it. So a typical treatment for toenail fungus would be anywhere from 12 to 16 weeks. So it's quite a protracted amount of treatment. The other thing too is even after the fungus is dead, it may still look like you have an active infection because of all this residual onycholysis and damage and pitting and so forth here. So even though the fungus may have already have left home, it may still appear like you still had an infection. The next method, oh, I'm sorry, another problem with oral treatment is not just the duration, but also there's problems with compliance. You have to take the pill every single day for it to be useful for those 12 to 16 weeks. The other problem with it is if you have some underlying health issues, like for example, if you have kidney problems or liver disease, or a very sensitive stomach, oral therapy might not be the best choice for you. So a competing therapy would be to use a topical therapy. So basically, we pour the antifungal into a form of nail polish, and then you take a brush, just like if you were applying nail polish, and you apply it across the nail. That, again, has to be done for months to be effective. And there's two products that I typically will prescribe for my patients for this. About 10 years ago, I used to use one called Penlac, but I've had very poor results with that. More lately, there's a new product on the market It may not be new by the time you watch this video, but that one is called Jublia. And I've had good results with feedback from patients that the Jublia worked for them. So again, you just apply it like nail polish once a day, and it kills the fungus gradually. So in summary, it's definitely a treatable condition. It's a nuisance. It's not life-threatening, and there's two main competing methods of treating it. Both of them can be effective, but both of them take a long time. You need to be patient for this thing to work. So that's toenail fungus and treatment in summary. Thank you for watching. Don't forget to subscribe so I can keep you informed as I upload new videos and new discourses. Thanks for watching. Have a great rest of your day.
Thanks for watching. Get notified of new videos. Subscribe now.